All right, hi everyone. I'm Luke Zabawa. I'm a fourth-year resident at UIC. I have no financial disclosures. So total knee arthroplasty has evolved significantly, especially with regard to patient optimization, anesthesia method, and surgical technique. Unfortunately, this has resulted in improved outcomes for patients, but surgeons continue to face declining reimbursement in the setting of rising costs and inflationary pressures. So the purpose of our study was to look at TKA reimbursement trends from 2006 to 2022, and then secondarily look at the projected surgeon reimbursement rate in 2030 for primary and revision total knee arthroplasty if the current trends continue. So we queried the NSQIP database from 2006 to 2022 for CPT codes identifying primary and revision TKA. From that, we were able to obtain data regarding surgical time and RVUs generated per case. We then used the AMA physician's fee schedule to generate dollars per RVU. And then we adjusted our physician rates for inflation based on the U.S. Consumer Price Index. And so the average reimbursement for primary and revision TKA was calculated per case and per minute. The total percent change from 2006 to 2022 was calculated. And with these values, we were able to come up with the compound annual growth rate over a 16-year period. And just briefly, the CAGR is a financial metric that is used commonly to assess the rate of change over time and adjust for volatility and fluctuations. And with our CAGR score, we were then able to calculate the projected physician reimbursement rate in 2030 if the trends continue. So here we can see that reimbursement rates per case have declined from 2006 until 2022 for primary TKA, one component revision, and total revision. And despite our improved efficiencies, the reimbursement rates have continued to decline for all three of the procedure codes. And so this table outlines the data, and I'll start at the top with primary TKA. We can see that in 2006, physicians were reimbursed about $1,200 for a primary total knee, but only $678 in 2022. That corresponds to a compound annual growth rate of negative 3.51% over that 16-year period. And in 2030, we can expect to be paid about $500 for a primary total knee. And I'll just highlight the total revision data because it's twice as likely to be performed as a one component revision. And we can see that in 2006, physicians were paid about $1,400. And in 2002, they only received $938 for a total revision. That corresponds to a compound annual growth rate of minus 2.52%. And again, in 2030, surgeons can only expect to be paid about $764 for a total revision knee arthroplasty. So in conclusion, projected reimbursements are expected to further decline, and we don't believe that this is sustainable. And the issue with this is that it will disincentivize surgeons to perform revision surgery, and patients will have decreased access to care. And total knee arthroplasty reimbursement trends really are just an indicator of the global trend that is going on in the orthopedic world, in medicine in general. And we believe that Medicare reimbursement policies should be tied to inflation to help ensure patients have access to care in the future. Thank you.